Studies show oil pulling can lower the levels of some bad bacteria and might help reduce gum inflammation. Oil pulling is not a replacement for brushing and flossing. And as much as I believe in nature's pharmacy, natural is not always safe. There are real cases where overdosing vitamin C, D, or even detox remedies and protocols have done more harm than good. The synergy for strong teeth and bones really rely on. So welcome back to our second episode on a 4-part series on oral health, why to look after your oral health and how that impacts your overall health, but also how to look after yourself naturally, which supplements should you get and why you should get them. And also I'm going to go through on our last and fourth episode about the details on how you should implement a good oral routine for yourself and for your loved ones. I'm going to show you how to actually brush, how to floss, and how to use accessories to improve even further your oral health. If you're new here, I'm Dr. Maria Florou. For over 25 years, I lived and breathed dentistry, not just as a career, but as a mission to help people transform their health from the inside out. My approach blends the latest scientific research with a real respect for the body's natural healing power, always seeing the mouth as a gateway to a whole body wellness. And even though I am a dentist for over 25 years, remember, I am not your dentist, and you need to seek professional help and advice for your individual situation. Let's be honest, these days the internet is bursting with advice about natural fixes for everything from coconut oil pulling to high dose supplements, from homemade herbal rinses to YouTube hacks for white teeth overnight. As a dentist and someone who loves natural health, I get the appeal, but also I see day in and day out the confusion patients have on what really works. What's hype? Is it safe to try that new thing they saw on social media? So many people turn to natural therapies for good reasons, sometimes looking for gentler options, sometimes because of past negative experience, sometimes just searching for a control over their own health. I've seen more than a few mouths harmed by aggressive natural acids or worsened gum problems from well-meaning but incomplete routines. So today, let's sift science from myth, explore what truly helps with oral health, talk about the most popular supplements like vitamin C, Coenzyme Q10, vitamin D, and K2, and get very real about what you should and shouldn't do at home. Let's talk about vitamin C, the unsung hero for healthy gums. Vitamin C is one of those nutrients you hear about every winter. Take it for your immune system, take it if you have a cold. But did you know your gums and teeth absolutely depend on it? Let's anchor this in facts. Studies in the past decade show people with higher vitamin C intake had up to 66% lower risk of developing gum disease. Flip that. Not getting enough vitamin C is sure path to bleeding gums, tissue breakdown, and if it's truly deficient, even a disease called scurvy, known for centuries for causing tooth loss and severe oral damage. Many don't realize that gum disease isn't just a matter of missing a cleaning. It's also about how your body builds and repairs tissue. Vitamin C powers collagen synthesis, repairs little tears in your gum lining, and keeps your immune cells in top fighting shape. One recent study found that supplementing with vitamin C even helps reduce gum bleeding for people struggling with diabetes, a group with notorious stubborn gum inflammation. So if you're thinking now, should I take just as much vitamin C as I can? Don't be so fast in running into conclusions. Ideally, have an appointment with an integrative doctor or a health allied profession that you trust. But as a general advice, too much vitamin C can cause stomach upset or diarrhea in rare cases, and sometimes even kidney stones. So more isn't always better. Instead, aim for a colorful diet, fresh peppers, citrus fruits, broccoli, berries. If you're under stress, or if you smoke, or even have chronic health issues, you may need a little bit extra of vitamin C in your body. I also want to mention to you that some of the recommended vitamin C that I advise my patients to have, or even myself and my family, I put on the description below just to make things easier for you. So now let's talk about coenzyme Q10, or also known as CoQ10. Coenzyme Q10 is made naturally in your body and is crucial for the energy that runs every cell, especially in your gums and heart. Studies, some quite impressive research, have actually found that people with gum disease tend to have much lower levels of coenzyme Q10 in their gums. When we add these, sometimes via gel or tablets to be swallowed, or mainly capsules, research shows a real reduction in gum bleeding and pocket depth. Sometimes I recommend coenzyme Q10 for patients with stubborn inflammation on the gums or with strong family history of periodontitis. But remember, while coenzyme Q10 can support healing, it is a booster, not just a band-aid. It's safest used alongside and never instead of professional cleanings, targeted brushing, and flossing. And for an advanced case, the advice of your dentist or periodontist is crucial. Coenzyme Q10 is generally safe, but can interact with blood thinners, and more isn't better here either. The benefits come from steady, moderate doses, not mega doses. Now let's talk about, I think it's my favorite one, vitamin D and K2. The synergy for strong teeth and bones really rely on these two, and we can't avoid but also talking about sunlight exposure, which I'm going to do later on this episode. If you followed medical news at all recently, you know vitamin D is headline news, not just for bones, but for immune health and even cancer defenses. We saw a lot of advice on vitamin D as well for COVID patients, but here is the dental twist. Teeth are living tissues, and their roots are surrounded by bone that depends on vitamin D and its often overlooked partner, the vitamin K2. To stay strong and resist infections, we really need this combination. Large population studies show that people with low doses or low levels of vitamin D are far more likely to suffer from periodontitis, lose teeth, and jawbone loss. But here is the insider knowledge. Vitamin D helps you absorb calcium, while K2 tells the calcium where to go, into bones and teeth, not into your soft tissues and arteries. One powerful case control study this year showed lower K2 levels are an independent predictor of more severe gum disease, regardless of age. If you're thinking about supplementing D or K2, get your levels checked first. Try to get vitamin D from sunlight and K2 from grass-fed dairy or fermented foods, if possible. But especially for those on blood thinner or with clotting disorders, don't add K2 without telling your physician. It can change how your medication works. Real quick, your mouth is the gateway to your overall health, and at Casuarina Dental, our focus is on you. If you're ready for a holistic approach to dental care, book your appointment now via the link in the show notes. Now, back to the episode. So now let's talk about some natural remedies, myths, misuses, and what actually works. Let's start with oil pulling, for example. We have a whole episode on oil pulling, so if you want to go back and watch that one, it is a really mind-blowing episode where there's a lot of data and research supporting the use of certain oils for oil pulling. So switching around with those oils for 10 to 20 minutes is an ancient practice with some genuine promises. Studies show oil pulling can lower the levels of some bad bacteria and might help reduce gum inflammation, and especially in mild cases. But and I say this as someone who loves a good home remedy. Oil pulling is not a replacement for brushing and flossing. It can be a nice addition, but it is not a cure to all cases. The same goes for herbal rinses, saltwater rinses, xylitol, and natural tooth powders. Used wisely, these can be gentle complements to your routine. Used aggressively as miracle cures, they might delay you from getting treatments for something more serious. So always make sure that you consult with a health professional. Now, some natural acids like lemons or vinegars are touted for whitening. Please don't do it. Acids erode enamel, and make teeth ultra sensitive. Baking soda is safer for occasional stain removal if used gently, but not every day and never as your only oral care step. And as much as I believe in nature's pharmacy, remember, natural is not always safe, and more is not always better. There are real cases where overdosing vitamin C, D, or even detox remedies and protocols have done more harm than good. So here's what could be missing from the flashy TikTok videos you might have seen. A real talk about the risks. So how high doses of vitamin C can cause gut distress, kidney stones, and interact with certain chemo drugs. Vitamin D and K2 can push calcium into places it shouldn't. Coenzyme Q10, while generally safe, can lower blood pressure or thin the blood just enough to cause issues if mixed with other medicines. So what is the important takeaway here? Always make sure you consult with your health professional, before, especially if you're on medication and you want to introduce something new to your routine. And all this advice is not meant to replace professional advice. So what we really need to aim is for personalized care. Targeted supplements when needed, based on your labs, your family history, and your overall health, avoiding unnecessary chemicals. Yes, but partnering with skilled professionals. And what I think is the most important part here is learning to see nutrition as a foundation, not a bottle of pills. Real food, a colorful plate, plenty of water, movement, sleep, stress management, all these matter for your mouth and body. And if you have an autoimmune condition, or you're pregnant, or having any disease, you're not excluded from these therapies, but you should always run this with your doctor first. I've treated hundreds, maybe thousands of patients who came to me after trying everything. DIY hacks, supermarket supplements, fair diets. One of my patients, let's call her Mary, she's a 40 years old that came to me with bleeding gums and a cabinet full of vitamins. She came with this long list of things that she supplements with. We tested her vitamin D and she was actually deficient. We adjusted supplements, focused on fibers and antioxidant foods to be complemented on her meals, swapped away daily lemon rinses and gave her some safer options. Sometimes when I see patients who have like lemon water in the morning, I don't necessarily say them, let's stop doing that, because I see the benefits of lemon water, but how we can use that in a safe way that we're not jeopardizing our enamel. Not only in Mary's case, her gums stopped bleeding with just a few tweaks, but her overall health and her energy levels also improved. So this is what I'm bringing to you today, is how small changes and supplementing with things like vitamin C, D, and coenzyme Q10 can actually have a good effect for your oral health and overall energy. So what are the main takeaways from this episode that I want you to consider? Introduce what's simple and consistent to your routine, whether it's supplementing with vitamin C, D, and K2, whether it's introducing the use of coenzyme Q10 or having more daylight exposure, allowing yourself to stay outside early in the morning, at least for 15 minutes, to absorb the vitamin D naturally, will really make a big change in your immune response. And when we talk about your oral health, that's also going to impact how your gums perform and how your body heals from inflammation. So thank you for staying to the end of this episode. I hope you got good value from what you've just learned, and I hope you know how and when to use the supplements that we have just gone through. And if you haven't subscribed yet, make sure you click that bell button so you're notified next time our episode comes out. On the next part of the series, we're going to talk about natural therapies, natural remedies for your overall health. We're going to go deep in sunlight exposure, sauna, and bouncing so you can understand better what you can do at home to feel better about your oral health just using natural therapies. Thank you for tuning into Mind Your Mouth. These episodes have been created for you. If you found this conversation helpful, the best way to support the show is by leaving a 5-star review on Apple Podcasts and Spotify. And don't forget to subscribe on YouTube so you never miss an episode. For more tips on holistic dental health, follow me on social media at Casuarina Dental. In the meantime, take care of your smile, take care of your health, and I'll see you in the next episode.